Noswaith dda, a chroeso. Good evening and welcome, everyone. It gives me great pleasure to be able to introduce a colleague this evening, Dr. Natalie Joseph-Williams. Natalie is a reader in Improving Patient Care at Cardiff University School of Medicine and Associate Director for the Health and Care Research Wales Evidence Centre. She's also a co-lead for the Wales Centre for Primary and Emergency Care Research and is academic co-lead for public involvement and engagement in the School of Medicine. Natalie has worked for Cardiff University for 17 years, and day to day she works closely with NHS teams, patients, and policymakers in Wales, the UK, and internationally to research and implement more patient-centred healthcare services. Natalie, it's great to have you here this evening, and we very much look forward to your presentation. We would encourage questions from our audience, so please use the Q&A function at the bottom of your Zoom screen. Over to you, Natalie.
Thanks so much, James. Good evening, everyone. Thank you so much for joining me for this Science and Health public lecture. I'll just share my presentation with you. Okay, hopefully everyone can see that now. I'm sure the team will let me know if there's any problems. So yeah, thank you so much again for joining me this evening and taking the time to do so. I've attended many of these over the years. I was absolutely delighted when my brilliant colleagues, Sarah and Karen, who organised this series, asked me if I'd like to come along and share my thoughts with you. So as James said, I am a researcher, but I'm also a patient. I spend most of my research days working out how we can improve patient care. I'm particularly passionate personally about finding out how we can deliver care to patients that works for them individually, or in other words, treating the patient rather than the disease. One of the most rewarding things that's happened to me in my 17 years of research is when I had the opportunity one day to meet a patient and they shared with me the difference that the research I'd done had made to them. Now, they didn't know who I was. They didn't know I'd written the research papers or the guidelines that informed the change in care, but they were just sharing their experiences with me about their visit to an outpatient team. They told me that the healthcare team made them feel whole, and it made them feel on their way to becoming more than they were before their illness. And when the team listened to them and involved them in their care, they felt like the sun had come out. So over the next half hour, we're going to explore how important research is to improving health and care in Wales and the difference it's making specifically to patients. I'll also be listening to you. You can tell me what you think the top priorities are right now. Importantly, I'm going to share how we take the people who are ultimately the end users and the recipients of this care with us on this journey, how we involve the public, how we work with them in our research studies, and how we make sure they're part of the change that we are making. So let's start with the basics. What is research? Well, research is defined as the scientific approach of answering a research question, solving a problem, or generating new knowledge through a systematic and orderly collection, organization of, and analysis of information. So that's the academic version. How about this definition from one of our public partners? It's finding answers to complicated questions in the best way possible, to know what's worked best and what needs to change. Now, I don't know about you, but I much prefer Bob's version to the academic version. And there's a long history of research improving health and care, throughout history. One of the earliest clinical trials we know about, it was taken place in 1747. And this is by James Lind. And James Lind was a Scottish doctor working in the Royal Navy. He selected 12 patients with scurvy on a ship. He divided them into 6 pairs and he gave them different treatments or foods throughout the course of the week. And he found the sailors who had the citrus fruits recovered well. In 1863, American Dr. Austin Flint used the first placebos in clinical trials for patients with rheumatism. Now, placebos are something that seems real to patients, but they don't have any therapeutic benefits. So it's really important to help us know the exact effectiveness and benefit of treatments. In 1928, Alexander Fleming discovered the first antibiotic. This is one of the most important scientific discoveries in recent history. It's crucial to saving millions of lives in World War II, and bacterial infections that were previously life-threatening were now easily treatable. In 1946, we see the first curative randomized control trials. And this approach of randomizing patients to receive different treatments or placebos has actually greatly improved the quality of the research we have from these trials. And it's now the gold standard framework when trials are conducted. And then in 1954, Dr. Joseph E. Murray from the US successfully transplanted a healthy kidney from Ronald Henrik to his twin brother, Richard, you can see there. Today, the questions go much beyond working out what the best treatments are for diseases. Every day, healthcare professionals and researchers are finding new and improved ways of screening, diagnosis, prevention, and treatment, as well as improving the ways in which we deliver and organize health and care services, exploring what these services should look like, who should be delivering them, when they should be delivered, what improvements they lead to, why they're working. And research comes in many different forms. You might be able to take part in intervention trials where you undergo tests or you take a different treatment or intervention. You might take part in an interview with a researcher where you share your views on a specific topic. Questionnaires are a good way to collect information from a large number of participants. These could be online or paper-based. Or you might be able to take part in group discussions, focus groups, workshops with other people to discuss your views there. But before we can do any of these things, we need to understand what the most important research priorities are. What are those questions we need to be asking? And what are those studies that we need to take on? So at this point, I'd like to invite you to share what you think are top research priorities for health and care right now. I know some of you have been doing this throughout the day as well. I shared these links on social media earlier. Karen or Sarah have also put this link in the chat for you. So I encourage you to click the link in the chat. It'll take you directly to the website. Alternatively, if you open up your camera and point it at the QR code and then click the link that opens up when you're in there, that will take you to the website too. So feel free to write as many different priorities that you can think of. These can be health related, they can be social care related, or they could be both. So feel free to keep sharing your thoughts throughout the presentation. The link will be staying in the chat, and then we'll come back to look at them in a little bit more detail at the end of the talk. So as you do that, I'd like to reflect a little bit on why research is so critical to improving health and social care in Wales. Bottom line, it's about helping patients to make the most effective, the safest, and person-centered decisions. And this is based on three things. This is based on clinical experience or expertise, the patient's values and preferences. So those things that matter most to patients, what they want to get out of their care, and then also the best research evidence that's available. But what difference does that research actually make day to day? I want to share some thoughts now of some key individuals that I've had the privilege of working with throughout the last few years. This includes the Chief Dental Officer for Wales, our public partners, and also Assistant Director for Social Care Wales.
It's great for looking at patterns of care, both good and sadly bad. Health research, I think, is incredibly important these days, and both the public as well as society put a high value on research.
Natalie.
The services that are being provided.
Yes, Sarah?
Oh, sorry, the sound, I think when you put yourself on mute, the sound stops, so we can't hear the.
Oh, okay. I'm really sorry. I'll start that
No,
again.
Research, I think,
okay.
is incredibly important these days, and both the public as well as society put a high value on research outcomes. Overall, health research can contribute to information about disease trends, the risk factors for various diseases. It can look at the outcome from treatment and any other interventions, particularly public health interventions. I also think research is great for looking at patterns of care, both good and sadly bad sometimes, the cost of that healthcare, so looking at it from an economic perspective, and how services are used. I think the different approaches to research provide a complementary insight these days into what we're actually trying to achieve with our health services. We're using more mixed methods research that's looking both at the data but also at the end user's perception of that using quantitative and qualitative data. We've relied a lot, I think, on using clinical trials for research, and these are really important for looking at the sort of benefit and the side effect of medical treatment. But I think more and more we're looking at the quality of the services that are being provided. However, I think we should also consider the social care aspect, as that is usually what the public tend to want to see from the outcomes of research. So how is it benefiting them, but also how is it benefiting society?
If you could imagine a world without research, we wouldn't have the proper evidence-based insights to guide decisions, and we'd have scenarios where treatments and policies and interventions were implemented without rigorous evaluation. So research helps us to understand what works, what doesn't, and more importantly, why. And it informs best practices, enhances patient outcomes, and ensures efficient resource allocation. And we have a lot of unfortunate examples of where research didn't happen properly. For instance, the thalidomide disaster.
I think that research is absolutely vital because it's the only way that we can increase our knowledge of health and social care to better meet the needs of our ever-changing population. And so without this research, it would just be impossible to provide life-changing treatments and improvements for the population.
So the reason I think that research is vital to supporting what we do around Wales in social care is that we have big ambitions about how we support people. So we in Wales have something called the Social Services and Wellbeing Act. We also have something called the Wellbeing of Future Generations Act. And they're both pieces of legislation that really set out some really strong ambitions about how we deliver care. What we do know, though, for children and for adults using social care services across Wales is there's a gap between the rhetoric and the reality. So there's a great report from the University of South Wales evaluating how the Social Services and Wellbeing Act, how effective it's been. And we know there's a really big gap. So research is really important to allow us to close that gap and also to think about how we use resources effectively and sustainably into the future.
Health research, I think, is
So there was a range of views there, but I think a number of common themes coming out from all of the stakeholders in terms of why research is important. It helps us to understand what's working, what's not working, and as Tony said, importantly, why that is the case. It helps us to make improvements, enhance patient outcomes and quality of services. It also helps us to look about how we improve the sustainability of health and care and plan for the future, and ultimately to better meet the needs of the population. So let's now take a look at some examples of research and the difference that it is making in Wales. Research is taking place every day across different universities, health and care settings, research institutions, and beyond. At the Health and Care Research Wales Evidence Centre at Cardiff University, we work together with Welsh Government, the NHS, social care, research institutions, and the public to deliver vital research that helps to tackle health and social care challenges facing Wales right now. And as Mel, our public partner, has said for here, our centre's focus is really on research that is needed, that is going to be used to inform decisions and make improvements for health and care. And we work with a range of partners across many different organisations that you can see listed here to achieve that work. And we also have a dedicated group of public partners, and this is co-led by Libby Humphries and Natalie Joseph-Williams. So quite often when we think about research, we think mainly about that conducting and that analysing stage, or that bit where we're actually doing the research and finding out what it means. But there are so many other steps to the research cycle. This includes identifying and prioritising which questions we ask and we study. So thinking about those things that matter most to patients, or what the current priorities are in health or social care delivery. Then we have to work out how we best answer those questions. Which types of study will we use? The methods that are involved. Is there evidence that's already available that we can go to look at, or do we need to conduct new studies? And then we carry out the research and work out what the findings mean. But through all of these stages, we need to be thinking about the key people that need to know this information when we do have the findings. And we also have to have a plan in place to make sure that we get that information to them. Then we need to make the improvements by putting the findings into practice. And this is called our implementation phase. And importantly, we need to monitor these changes to make sure that they are resulting in benefits, and also understand the impact or the difference that that is making, good or bad. And that could be to patients, clinicians, healthcare services, organisations, and beyond. So thinking back to that example I gave you at the beginning, where a patient shared how the research I'd done had made a difference to them, I think the best way to see the benefits from research is to listen to those people who have needed the evidence, and then ask them to share how they've been using it in practice to make a change. So again, I'm going to bring in Andrew, our public partners, and Lisa Trigg as well, to share this with you. So our first evidence centre case study that I would like to share revolves around dental services and what they could look like. So last summer, the Chief Dental Officer, Andrew Dickinson, submitted an evidence gap to our centre. And here is Andrew telling you a little bit more about the study that we are supporting.
It's been a real privilege working with the Evidence Centre on a dental specific project. To date, dentistry has relied on a combination of quantitative research and service evaluations to identify the challenges for patients accessing dental services in Wales. So from that, we know that there are key barriers, including the financial element and the cost of treatment, what it is to live in a more rural or dispersed community, seeing the imbalance in resource allocation in different parts of Wales, the limited availability of appointments, and then the psychosocial impact as well. Particularly, we know a lot of people have anxiety about receiving dentistry. However, we actually know very little about the Welsh population's perspective of an ideal dental care service, their understanding of the dental team and how that could support them in improving their oral health, how they'd like to access emergency and routine care, or what they would actually wish to gain from seeking that dental care itself. So this is where the Evidence Centre has been really valuable in helping me to explore the public's vision for an NHS dental service, gaining an understanding of what they perceive to be a dental team, how they'd like to access care, and what their key priorities. And this has been through a series of interviews and public workshops. For me, having that public perspective on what is an acceptable service is absolutely vital when it comes to deciding on policy. At the current time, we're looking at a reform of the dental service across Wales. And we really need to know a lot more than just the fact that they can't access care. We need to really understand how we can improve the whole experience. And this will lead to further engagement strategies with the public as we co-design that future research and the reform of the dental services. But I think what we have learned is that any reform to services need to reflect that public need and their preferences. So it will help me guide a more streamlined communication strategy, which will help us focus on increasing the public's knowledge about how a dental team works, who works within a dental team, and more importantly, how they can actually start to develop a person-centred approach for the people in Wales.
So that was some of our work focusing on dental services, as you can see. But another significant challenge facing the NHS and social care in Wales and in the UK as a whole is the increasing number of people living with long-term conditions or multiple long-term conditions and the demands that that puts on the services. So to make sure that we are better prepared to meet these patients' needs in future, it was really important that we knew how many people are likely to have these conditions going forward. So early last year, Welsh Government Science Evidence Advice Division asked if we could help inform a report that they were writing. So our partner, the Wales Centre for Evidence-Based Care, produced a rapid evidence map, which is basically a detailed description of all of the available evidence. This evidence was then included in the NHS in 10 years' time report prepared by the Welsh Government's Science Evidence Advice Division. It will inform a refresh of Wales's long-term plan for health and social care, known as A Healthier Wales. It was referred to by the Minister for Health and Social Services during a Senate debate. And I'm sure, as you can imagine, it's also attracted a lot of media attention. So some of our work also has a public health focus. More and more people in the UK are getting special procedures, which includes things like tattooing, piercing, acupuncture, and electrolysis. But these do come with some health risks. So a senior environmental health advisor from Welsh Government got in touch when we were reaching out for priorities last year, and they requested up-to-date evidence on these procedures. This evidence review has been used to support Part 4 of the Public Health Wales Act, which talks about special procedures. It will inform 5 sets of new regulations, which are currently in draft. It's been included in the Level 2 award for people who conduct special procedures. And it's also going to be endorsing the implementation of a new licensing scheme. And so our final evidence centre case study I'd like to share with you covers a request that came from social care this time. Now, we know the social care sector has suffered significant staff shortages, particularly since the pandemic. So here is Lisa Trigg, one of the Assistant Directors of Social Care Wales and the Assistant Director for Research, Data and Innovation, telling us more about the work that we have done to support them.
So we've been working with the Evidence Centre since its very inception back in the COVID days. And we've worked on a number of projects. The one that comes to mind is one where the Evidence Centre helped us to look at what works to attract, recruit and retain care workers and social workers. So that was incredibly helpful because recruiting those workers is really difficult and has become more and more difficult over the last few years. But what the work the Evidence Centre has done is help us understand what really works in practice. So it's not a gut feeling about, whether certain ways of attracting or advertising or trying to get people to apply for jobs is actually as effective as other ways. So we got a really good report from the Evidence Centre, and that's really helped us focus some of our efforts on what to do, but also what not to do.
So I hope those case studies just provided some examples and some ideas of how research can be used to inform policy and practice decisions. The links to all of those reports are in the chat for you. The team have been putting them in. And also there is a link to the full report library where you can go and read a lot of the other reports that we've also produced as well. Now I'd like to share with you how we work with the people who ultimately receive this care and how we take them on this research journey with us. So our evidence centre, we're very fortunate to be supported by a dedicated group of 11 public partners. And one of our public partners, Bob, has written this wonderful poem about what it means to be part of the Evidence Centre Public Partnership Group, or the PPG as they're known. So this group is critical to our work. They help us decide what research questions we take on, and they're part of our research teams. They're involved in meetings that we have with Welsh Government, NHS, social care representatives, and they also help to inform our analysis and the write-up of our work as well. Bottom line, they're making sure that the patient voice is part of all of our work from start until finish. And Andrew, Betty Jane, Tony, Lisa and Mel shared their views with me recently on why public involvement is so important to research. And so I'd like to share this with you too.
I can't see how anybody could argue against having stakeholders and members of the public and researchers being an important part of the equation in terms of delivering and improving health and care services.
Very proud of in social care and social care research is that we have a very rich tradition of co-production and involving people who use care and support in our research and in everything we do in terms of designing not just research but ways of changing or improving services. Because we really believe that the only people, well, not the only people, the people who know best about what will work are the people who use those services every day. So it's vital to us to include people who use care and support in our work, and particularly around research, but also the people who care for them as family carers or friends, and also people who are doing the work at the front line. So we believe very strongly that the best work comes from that kind of co-production world where people work with each other to develop good research and to get research into practice.
I think the involvement of public partners ensures that the research is relevant. It has ethical considerations and community engagement. I mean, I found that I've been able to provide unique perspectives on questions, enhanced study design with, especially with this dental services project, and contribute to meaningful outcomes. In general, I think public partners amplify the impacts of research by ensuring that it aligns with real world needs and experiences.
Public partners are crucial to the philosophy of getting it right first time. I think one of the things that we've learned over many years of research is that if we don't engage the end user, the people who actually use the outcomes of that research, then actually the design could be wrong from the beginning, which is both wasteful in time, money, and resources. What I've learned working with the Evidence Centre is that the public partners are willing to engage in this research, and that is a brilliant way to ensure that we ensure that the outcomes of the research are valuable to the people where it matters most. Those end users of this health and care system, the members of the public, bring a lived experience to those discussions, and it makes the findings very real. They tend to bring an authenticity and openness and a knowledge which is vital to challenge policymakers like myself when making any changes to the healthcare system.
it's so important to include the views and experience of the public in all health and social care research, as without them, the research would be extremely limited and possibly not even very successful. And within the evidence centre, I think the public partners are really able to help shape both the research topics where gaps have been identified and also the questions themselves. So that means that the research conducted is much more likely to meet the needs of the Welsh population and also to reflect their priorities.
So we can really see there that there are a number of different benefits to involving members of the public and patients in our research as partners. But I'd also like to share this with you too from our fantastic public partner and co-lead for involvement engagement in the Evidence Centre, Libby Humphreys. So Libby told me that not only does public involvement have benefits for the research, it can also help the public contributor. Now, Libby, who lives with multiple chronic health issues, told me that the research involvement that she's been doing has really helped her to feel like she has a purpose again. And so I'm so pleased recently that Cardiff University recognised Libby's contribution and her dedication to our work and awarded Libby the Honorary Research Associate title. I think this really shows that Libby's not only a public partner, but she's also a research partner as well. So earlier I asked you to let me know what you thought the most important research priorities in health and social care are right now. You might still be doing that and feel free to keep adding. There's been a range of great responses via the link. There's been a little bit of work going on in the background during my talk. And now what I'd like you to do is to look at some of the broader categories that were coming out as priorities and let us know what you think is a top priority. So Karen will put this link again in the chat so that you can click the link and go directly to that website to vote, or you can open the camera on your phone again and aim it at the QR code, which I'll put up shortly. Here's just some examples of things which have come through from the people that have already participated in my presentation today. Whilst you go to the website to vote, I just wanted to share one last video with you. And this is Lisa's views when I asked her about what she felt the most important research priorities were in health and social care right now.
So I think that I can't answer that question. And the reason I say that is that we think that the people who know about what research needs to be done are the people who use care and support and the people who work with them and their families. So we've been working over the last 3 or 4 years to do really careful and inclusive priority setting exercises. So we have completed 2. One is around family support services and one is around care and support for older people. And we're just doing another 2 priority setting exercises. And these are with, as I say, people who work in social care, people who use social care, people who are supporting people as unpaid carers. So we're doing 2 more exercises as we see they are hugely valuable. One is around what adult social care people in Wales need. So trying to get an understanding of what the need for social care is across the adult population. And then the second one is a really important one is about how children and young people will transition from children's social care into adult social care, which is a really tricky stage of social care to manage. So we really believe that we don't know what the right questions are, but the people who are using care and support and who are experts with lived experience are really the people to ask.
So we've come to the end of the research journey. We started the presentation by looking at what research means. So this seems like a good place to finish. So Tony looked to AI, as many of us are doing these days, just to see what it would say when it was asked what research is. And we were both incredibly surprised at how human and nice this response was. Remember, research isn't just data, it's hope, progress, and a commitment to better futures. So with that as our closing thought, I'd like to thank you all for your time this evening. Please do stay in touch via X or our website or my email. But for now, I look forward to answering your questions. Diolch yn fawr.
Thanks very much indeed, Natalie, for that fascinating overview there. I'd just like to remind our audience that they're very welcome now to start posting their questions in the Q&A at the bottom of their Zoom screens. Whilst we're waiting for the first questions to come in, Natalie, perhaps I could just ask you a little bit more to comment maybe about the increasing evidence of getting patients and physicians involved in decision making, and what your thoughts on that, please.
Yeah, thanks, James, of course. So outside of the evidence centre work that I do, my main area of work is actually around person-centred care. And I think what you're talking about is shared decision-making between healthcare professionals and patients. So there is increasing evidence that there are a number of benefits of this approach for patients, the clinicians and healthcare services as a whole. Ultimately, if patients aren't involved in healthcare and treatment decisions, if they don't have the opportunity to say what their goals are, what they want to get out of the treatment, what outcomes they're prepared to put up with, what risks they're prepared to take, then they're not going to be making the right decision for them. Recently, there's been quite a few policy changes, certainly at the national UK level. NICE have recently produced and published a guideline for shared decision making, recommending that anyone who is seeing a patient who needs to make a treatment decision or a management decision should be involved in them. And again, there's lots of other organisations that are following suit, the BMA and other royal colleges. So personally, I'm very passionate about that area, as you can probably tell. And firsthand as a patient, I've experienced the difference that it can make when you're asked what matters to you and involved in those discussions.
And do you think we're doing enough to train young sort of health professionals in making those joint decisions?
I think we are doing it, but we can certainly be doing more of it. We are getting a lot better. It's certainly been embedded into undergraduate medical curriculum in Cardiff University. That's something, again, that I'm really hopeful for. And I know that it's been included in other healthcare curriculums at Cardiff University too, such as physiotherapy and nursing. And this will be a really important step because they are the healthcare professionals, medics of the future. Day to day, again, there are some really motivated clinical teams around Wales who want to do this. They want to involve their patients more and deliver person-centred approaches, and they're making real changes. But yes, we'll keep working. Another thing I'm working on at the moment is with Health Education Improvement Wales to develop a training programme for all healthcare professionals in shared decision making. So hopefully with something like that, one place everyone can go, it will help with that as well.
And just coming back to some of the potential challenges of that, there are complex concepts that have to be conveyed and shared with the patient, like understanding risk and things. How can we kind of potentially improve that aspect, you think?
Yeah, it's not always easy. It depends on the healthcare condition, and as you say, the complexity of the risks. And there is a lot of uncertainty in healthcare. That is one of the problems. But there are certain techniques that we can be using to help patients to become more risk literate, we would call it, so that they have a better understanding of what uncertainty is. And there's ways we can present the risks to them in easy to understand ways that they digest. NICE guidelines includes those ways. That's included in some of the training programs I'm doing. And if the risk is conveyed in that way, then certainly people are able to understand it, and most importantly, understand what it means to them individually as well.
Great. Thanks, Natalie. Just picking up the first question here. What are your thoughts on the current level of communication between the NHS and childcare sector of social care?
I'll be honest, it's not something I'm involved in day to day. So I'm not able to comment on the level of it personally. Thinking about other healthcare services, whether and social care services, I think we would all agree there's definitely room for improvement in terms of communication between the services and between the different professionals. Looking at the priorities that were coming through that people were submitting, a few people mentioned better coordination, better interprofessional, inter-team communication, so that information about individuals, whether they be people in care services or in healthcare services, is easily available, it's up to date, and then people can help to make, or support informed decisions. So, sorry, I can't be more specific on that. It's not an area of work, but yes, I certainly think that better coordination will be important.
Yeah, so someone is complimenting you on an excellent talk. You've spoken passionately about the important role of patient and public partners in research. Wales has made a big contribution to leading the charge on this essential agenda in the past 10 years. But what more is still needed to involve patient and public partners in an inclusive and meaningful way?
Well, thank you.
What does world-class patient and public contribution look like?
Great question. So yeah, absolutely right. So much has taken place in the last 10 years, and I think Wales are a great example of how to involve members of the public, whether they be patients or otherwise, in our research. Health and care research Wales have made great strides to support that as well. So big changes have happened, certainly in my research career as well. It is now more the norm. And it's also now more the norm to involve people from start to finish, rather than just at certain points in the research cycle. What more can be done? I think there is a lot of people who are willing and feel able to contribute to public involvement in research, but unfortunately, there's still so many people who don't feel able to take part for various different reasons, and there are many barriers. So what does world class? I feel like if we get to a point where everyone feels that they can contribute something to research and they feel able to do that, so that they're supported in the right way that works for them and adapts to their needs, I think that would be a pretty good signal that we are leading the way at that point.
Thanks again, Natalie. What would be the most important area that we should carry out research in? Is it potentially mental health in young people, especially after COVID and statistics showing lots of young people are not able to work?
Gosh, yes, there's a lot of areas where are priorities. I will say that is a significant priority. Again, looking at the comments that were coming through that I was keeping a track of on my iPad, that was something that was coming up time and time again. How can we better support younger people's well-being, their mental health, both in terms of diagnosis, but also in prevention services and support services? I could see a question around looking at the impact of mobile phones and social media on the health and well-being of young people. So I do feel that is a significant issue that does need more research.
Thanks, Natalie. A couple of related questions. Many of the issues mentioned today reflect poorly functioning NHS system. How can this be improved going forwards? And relating to that, my feeling is that many of the topics suggested for research are really cries for help in delivering a health service which is fit for purpose. Many of those could be addressed by better management and communication within the health service and do not need further research. Should you be focusing your efforts at more longer term goals? So a couple of challenging questions there.
Yeah, that's a really important point. So to go to the last bit first, certainly we always want to have a longer term goal in mind when we are thinking about research. In terms of not needing any more research, I think that if we explore what isn't working and learning from that. That is research in itself. And we can learn a lot from what's not working, why it's not working, because then that can help to inform better ways of working, whether that's managing, whether it's the ways we're delivering services, where we're delivering services. So I understand their comment, but I would still say that research plays a really critical role in that improvement and learning space as well. So definitely still need to do that.
Great. Another compliment, great presentation. Research must be a priority in redesigning our health and care system, but with our healthcare system under sustained pressure, how do we raise the profile of research amongst competing priorities?
Again, a really important question. We are acutely aware with all of the work that we do, because it's all health and care related, we need to have the people who are delivering these services engaged with us. It's really, really important. But we are aware that, as you say, they're under increasing pressure. They have other demands. There's time issues, there's staffing issues that are critical at the moment. I would just say that we have to think outside the box and think about different ways of involving these people so that it does take account of those pressures. So, 6, 8 years ago, if we were doing a focus group and we wanted to speak to a clinical team about something, we'd expect, to get everyone in one room, and then we'd all be there for an hour, 2 hours discussing this. Luckily, with the rise of virtual ways of working, like Zoom, like Teams, like shared collaborative working spaces online, I feel that that's really helped to alleviate some of those pressures, because people can communicate in different ways that fits a bit more with those other demands. But we are acutely aware these people are under multiple competing pressures.
Thanks again, Natalie. I don't feel that social care is being provided correctly. How long does a patient need to wait for a care plan and to see a social worker? How can we prevent a patient feel so worthless when they're being passed around instead of supporting the required need at that time? So some frustration coming through there. And related question on social care: how often does social care in Wales interact with other countries in terms of different types of training and techniques?
Okay, thanks for that. Yes. So let's go with the first question first.
Yeah.
So I can hear the frustration. Again, I'm not we're working day to day in the services. What I will say is, through my work with Social Care Wales, and through the videos I've shared with Lisa, they are acutely aware that there are some gaps and there's things that need to be addressed, and that's why they are conducting these specific prioritization exercises to go speak to service users, to go to speak to people who are involved in that system. So I would encourage to share any views you have via those routes, because they want to learn, they want to understand what the changes are that are needed, and to hear from the voice of those people who are using the services. So the second question was around, could you remind me, James?
It was how does social care in Wales interact with other countries in terms of different types of training and techniques?
Oh, again, I'm not entirely sure. As a researcher that's sitting in the university, I wouldn't like to comment on that. But just from our interactions with them, I know that they do collaborate, they do work, certainly across the 4 nations in the UK, to share learning. Some of the work we've done for them was also shared to the other nations around recruitment, retention of staff. So I can imagine that ethos underpins all of their work.
Great, thank you. I think this is more of a comment, someone from the Ataxia Rare Disease Charity. Much appreciated being a PPI member. So appreciation there. So perhaps we'll just finish off with this last question then for you, Natalie. What has been your favourite research you've been part of? Someone's asked.
Oh, that's a great question. Gosh. Personally, for me, it is the work I do around shared decision making. So that has to be, yes, I'm very passionate about that. That is what I've done for 17 years. We worked on a project called the Magic Project that was between 2008, so around about that time to 2012. It was an implementation study and it was new for me. I'd come from a randomized control trial background when, sort of working on trials where patients had interventions, but we didn't really know much about what happened after the study and this funding had ended. And we'd published the papers, but this was very different. We were working directly with clinical teams, very passionate clinical teams who wanted to make a change. And that was the first time, well, I got public partners involved, so I'd heard that we should be doing this, we should be having PPI reps. So I reached out and I worked with a fantastic group of people there, and they actually helped us to create some interventions that were then embedded into routine practice. So I got to say that's probably one of my favorites, and certainly the one that's driven my passion for this research.
There's one more question come in again, popped up. Do you think e-consulting is the correct way to use for complex cases?
So we have done some work around e-consulting. I've done that myself, and we've done some research to explore the benefits and the downsides. It's always going to be situation dependent, and the person has mentioned complex. So the work that we have done has shown it works very well for certain conditions, for people who want to engage in that way, that it's a convenience for them, it's an easier way of communicating and keeping on top of things. But it doesn't work for everyone. So I think that's the most important thing to say is it doesn't work for everyone. It has to be decided on what's going to work for that patient, for the team as well. And I would probably guess that if they're very complex cases, then it's not going to be the best approach for that patient.
Thanks again, Natalie. So I think that draws things to a conclusion this evening. I'd just like to thank our audience for their active engagement. There's many comments coming in, how much people have appreciated your presentation, Natalie. So many thanks once again for providing such a superb overview of your work, and much appreciated. So this is the final lecture in this year's series. You will be contacted by my colleague Karen Edwards via Mentimeter to kindly provide us with some feedback for this evening, and potentially also for your ideas for our 24-25 series. So diolch yn fawr iawn. Thank you very much, everyone, and much appreciate. Thanks again, Natalie. Nos da.
Thanks all.
Yeah, good night.